Welcome, Dr. Mike.
Welcome. Thank you.
I wanted to talk to you about the AMI in-person trainings. I know they're they're a big important part to medical integration and the AMI model. So if you could just go into the in-person trainings here in Clearwater.
Sure. Well, AMI is based on systems, and systems only work if they're one, duplicatable, and two, usable. And the only way to do that is to train with them. So what we've done is reverse engineered what do our clients need to be successful, and then we provide the training for that. And the way we provide that training is we try to do it so that you can have as much of the training as you want. You can come back every month if you want. So that's why we do the trainings.
And how do we break it down? There's sales and marketing, and then there's essentials. Let's start with essentials because I've been to those trainings,
Right.
and they are, man, people get really motivated and they run back to their practices.
Yeah, well, what happens is when you get into this world, there's a transformation that occurs, and transformations can be a bumpy ride. So we want to minimize those bumps, and the way we do that is through education. So a lot of the education is for viewpoint shift. That's what we're trying to do so that people can look at things differently. Most of our clients want a practice that is not chaining them to the treatment table where they're there all the time having to do the work. They want a practice where they can help more people and have other people delivering systems that makes the practice help more people.
Yep.
You get better results and you get better income. So to do that, you have to have certain viewpoints. So a lot of our training is focused on viewpoint shift. That's why we do the vision boards.
Yes.
On day one of the training, of the essentials training, where we're helping our clients to draw out what is their practice going to look like in 6 months or a year.
Yep.
When they actually have it done, what's it actually going to look like? So they have a vision of where they're going to go. So we do that. We do the training on how you talk to your patients, and then why we're there. I mean, what is the current state of healthcare? We cover that on every training. And then what are we doing compared to what the current state of healthcare is? Because in the United States, I don't think too many people disagree that our healthcare is pretty pathetic, pretty
Yep.
expensive, and pretty ineffective.
Yep.
In fact, the most expensive and one of the most ineffective. So how do we fit into that? How can we change that? You know, people can bitch and bitch and bitch about a system being bad, but unless you have something that's going to replace it, you're just bitching.
Yeah.
So what we're doing with the essentials is we're showing them this is the replacement model. This gets people well. We're addressing the largest segment of healthcare, the biggest market in healthcare, which is pain, chronic pain from chronic degenerative arthritis. That's a $700 to $800 billion a year market. And chiropractors, most of our clients are chiropractors, get a little sliver of that, yet they're very effective. A lot of medical doctors are now turning to AMI. A lot of nurse practitioners are turning to AMI, physical therapists, and even acupuncturists, because they want to have a bigger, better practice as well. And so we're not selling out our purpose. We're actually showing our clients in this essential training what the vision is, what the purpose is, how can they get there, and what are the changes they have to make in their mind first, and then in their practices.
Awesome. One of the parts of the trainings that I've seen, because I've been at a few of them, is the sales or closing care plans. A big part of that is the role playing. You want to elaborate on the role playing part of it?
Well, the reason we created that training is because insurance, the number one reason to go bankrupt in the United States personally is unpaid health bills. And 72% of the people who go bankrupt from unpaid medical bills had insurance. So obviously, insurance is not doing the job.
Yep.
If that is the leading cause of bankruptcy, which it is. So you have to be comfortable in asking people, look, I know this is not covered by insurance, but if you want to get the results that you're looking for without the side effects you're trying to avoid, some of these things you're going to have to pay for. So we teach our clients how to do that. Sales is a thing that scares the hell out of people because everybody's been ripped off, right?
Yep.
Everybody's been through that experience. So the way you show people that you're not going to rip them off is you have to gain their trust, and then you have to show them the value of what you're doing. A friend of mine, Brandon Dawson, made a statement one time, and it rings my ears all the time. Price is only an issue in the absence of value. So in the sales training, we're showing you how to explain and demonstrate the value of what you're doing while earning the trust of the patient. So that when that comes down to, okay, this is covered by insurance and this is not, and this is how much that is, the patient realizes, yeah, that's going to hurt a little bit. I got to put that money out, but what I'm getting for it is valuable. So that's why we do that training. I love that training because you see the epiphanies go off.
Yep.
While people are doing it. We do the role playing
Yeah,
because
that's what I was just going to say, the role playing.
you have to demonstrate how to do it. So the number of times you do something, the more confident you get. And confidence is the thing that speaks the most when you're trying to promote a product or service. So we role play. So we want to get people in the habit of role playing. So we do it here at the training so that they'll go back to their office and they'll role play there. And anybody who's ever been to Grant Cardone's office, which is like a machine, you see every morning at their morning meeting, they just go into role play mode, and there's hundreds of people role playing in the same room.
Yep.
And it's kind of exciting.
Yep.
But we teach how to role play so that you're not making mistakes with the patient. You're making mistakes before you go in the room with the patient.
Got it. So AMI are in-person trainings, part of the AMI model and medical integration here at Advanced Medical Integration. Thank you, Mike.
You're
Appreciate
welcome.
it.
Glad to be here.